Hi all, this is Steph from Surgery App. Today is Wednesday, 23rd of February. We are very excited to show you the new workflow management system that we've built for you as requested by some practice managers. So currently, when patients submit admin requests to you through the app, non-clinical queries, such as requests for sick notes, they usually come into your inquiries at or admin at email address. So some practice managers said, look, there's no audit trail there, and they find it very difficult to keep track of that work. So they've asked us to build a workflow management system for any patient requests coming through the app. Now, as you know, we do have a website offering coming out in May. So any forms submitted through the website or the app will also go into this workflow management system. So we'll share screen now to show you what we've built for you. So from now, you can set up in your own management portal, you can now set up receptionists. And when you set them up, this is the view they see. So it's very different to the view you see as a manager in the management portal. They can only see form submissions or My Health Online registrations. And also, hopefully, quite soon, NWSSP will allow us to allow GMS1 registrations through the app. So once that becomes online, the registrations for My Health Online and GMS1 will also be submitted, and receptionists can then process those applications. But for now, we'll concentrate on form submissions. So we can see the app here for Grange Road Surgery, our test surgery. If a patient clicks on admin query and submits any of the forms which you have available in your practice, such as request a private letter or acute prescription request or submit a photo, whatever it may be, these will no longer come through to your inquiries at or your admin at email address. They will come directly into here, into form submissions. And you can see here, we've got two test forms here. Let's click on this one first, request a private letter. I submitted it as a test patient. So if your receptionist or your admin person clicks on view, they can view the form. The patient details appear here. And then the form itself, the contents of the form will appear on the right-hand side. You can also download the form as a PDF if you wanted to, or simply, if you need to copy and paste this into clinical records, you can copy and paste. We have also been requested by some managers who've helped us develop this. We're going to add here a quick copy button. So when you click on copy, it copies all of this here, and then you can quickly copy and paste that then into Vision or EMIS. But the management, so the audit trail that we've attached to this is here. So currently the status is new because it's a new submission, but it's assigned to nobody at the moment. So when a form comes in, we've been asked to be able to assign forms to certain staff because certain staff members in practice will process different forms. For example, some receptionists will process fit note requests, others will process other forms of forms. So you can actually assign the job to a person in practice. So I'll assign this to myself now, and I'll just put a note on there to say, or I'll send it to somebody else in practice. So let's assign it to the test receptionist. Please code to EMIS. If I save that now, that's now been assigned to that staff member. If I scroll down here, we can see the full audit trail that I assigned it, on what date and what time, and the notes I added. So I can say now that that is in progress. So the form hasn't been completed, it's in progress. If I go back to form submissions, we can see here that the form from myself, request for a private letter or form, is currently in progress. So if any staff member does do something with a form and they go off on sick or they've got a day off, anybody else then coming in can see right, this form is in progress, they can view it and they can see the notes that have been completed by that person. If then they want to complete, they can say then coded to EMIS. I'll correct that. Coded to EMIS. And instead of in progress, you can see complete and then save. And then again, that entry will be there in the full audit trail, and then when we go back into form submissions, that entry has disappeared. If you wanted to see another audit trail, or you wanted to go in as a manager and see what's going on, you can just click here and include completed forms, and that shows all completed forms and if you want to view anything, you can see the full audit trail of what's been done by each staff member on what date and what time. So that's like a smart inbox for you now. So to get away from using an inquiries at or an admin at email address, you've now got that functionality of a smart inbox, if you like, where you have full audit trail for any form submissions. So that's it. That's as simple as it is, really. We've made it very simple for people to use. And we've also had some other development requests, which I'll go through now. So when form submissions do come through, we've been asked to build tiles for different form submissions. So every different type of form submission will have its own tile. So if, for example, if you're going in as a manager and you want to see how many form submissions you've got for sick notes that day, how many form requests you've got for doctor's letter that day, it'll have a tile there. We're going to update that. We'll advise you of that other release date for that. We've built this, and this is live now for you guys to start using. Also here, registrations, they will come in from now on into here. So if you want to assign registrations for My Health Online to receptionists, so it's not coming through to you guys as practice managers, you can assign that now to your receptionists. If I log in as a practice manager, you also have a view for this. Bear with me, I'll just make myself a manager again, not a receptionist. Here we go. So I'll just make myself a practice manager again. There you go. So I'll log in now as if I were a practice manager. Yeah, so in your portal now, you can see also form submissions. If you wanted to view as a manager what's going on for the day, you can also see here how many forms are outstanding and what's been completed. We've also been asked to build a full reporting software around this, which we will do also. So you can see reports of the type of forms coming in, how many forms you've had per month, quarter, per year. Again, so you can really build your access standards around those forms. And if you have any reporting to do to the Health Board under access guidelines, you can then submit those reports. You can see here as well that there's a new button for receptionists. So if you wanted to set up receptionists, previously you had to ask us and email us to do this for you. But you can now set up receptionists on your own. So you can just click on Add New, put the receptionist's first name, surname, email address, and their status as active or inactive. Save, and then that receptionist will get a registration email, and he or she can then register and have access to the receptionist view portal. So that's gone live now. So if you want, so you can start using this from now. The email submissions will stop coming through to you from Monday next week, and any form submitted through the app will now come through to this workflow management system. And if you want staff to have training, we can start that with them. We will produce and send you all a sort of walkthrough of what I've just shown you, so the staff can see that themselves and just view that as a training tool. Log on at any time to view that. So that's an overview of the workflow management system. There's no extra cost for this. We've built it in as a free resource for you, just to help you manage your workload a bit better. As I said, the upgrades will be developed over the next week or so for the tiles view and the full reporting. So we'll advise you again of when that's available. But this is now live. You can start to use it whenever you want. Any questions you have on it, or if you have more development requests, please do let us know. Okay, thank you.